Hi there, my name is Michelle Claremont, and today, I'm a fatty liver disease advocate. My 15-year-old daughter was diagnosed in 2008 with fatty liver disease, and since that time I have been running a support group on Facebook where I've had 200 to 400 members at a time who are dealing with the disease all over the world. This disease is growing. In 2008, when my daughter was first diagnosed with it, that they were saying it was 1 in 5 people in North America have this disease, and now in 2011 they are saying 1 in 4, and they're predicting by 2015 it'll be 1 in 3. In Vietnam right now, they're actually saying it's 1/2 of their population has non-alcoholic fatty liver disease. What's non-alcoholic fatty liver disease, you would ask yourself, and quite often you wouldn't know what that would mean. Most people don't. My goal is to ensure that you are now aware of this disease and you are avoiding it in your life. And today's video is going to be very focused on avoiding it for your children. I think that's one of the most tragic parts of this disease. It is affecting babies right from birth through to 18-year-olds, right up through 50, 60-year-olds. But I'm going to focus today on the risk to our kids. Fatty liver disease occurs and probably has been occurring in our bodies for as long as we've all been around. Fatty liver disease was initially thought it was only related to alcohol. So when you ended up with cirrhosis, that was because you drank too much. And we all know that drinking is bad for your liver, so we would never consider feeding our child alcohol. You might give them a little bit a rub on a sore tooth that's coming in. That's the kind of thing we're looking at here. But that's not something you would give your child on a daily basis. What I now know is that we are actually feeding our children something that is treated like alcohol in the liver, and that happens to be fructose. And that has been proven by a number of research studies. If you have a look at fructose and the liver on Google, you will find a number of research studies now that make it clear that there is a direct impact to non-alcoholic fatty liver disease. Dr. Robert Lustig is the author of a book called Sugar the Bitter Truth. I have watched his video and some of his speeches. It is actually good to have a doctor agreeing with this disease and knowing and understanding it, because one of the things that people with this disease deal with is it's an invisible disease. So it's one of those where you don't look sick. Symptoms in the early stages are exhaustion, insomnia, and stomach aches. Our kids have those all the time, so you don't tend to think that there might be something more serious going on. I remember with my own daughter, who now has the disease officially, she always had stomach aches as a little girl. Stomach was always an issue for her, but we always thought, and most people do think, that it's kids not wanting to go to school, it's kids not being accountable, and just trying not to have to get out of bed. So I know that I was guilty of, forcing her to school sometimes, and she would have nausea quite frequently, but I didn't think anything of it. In 2007, she got sick with pneumonia. Her brother had pneumonia. It was a nasty experience. I remembered well. It took a good 6 weeks to get past her pneumonia. She was through a number of rounds of heavy-duty antibiotics. Once that pneumonia cleared, however, she didn't really recover. She got what they called mono about a month and a half after she recovered from pneumonia. And after that, that just never seemed to clear. She was always exhausted. She was always, she couldn't sleep. She actually lost her appetite for a while. And this was not my child. My child before 2007 was high energy. She was never a sleeper, I will say that. So I don't know if her symptoms have actually been there her whole life, which is entirely possible. She has had insomnia and stomach aches since birth. So here's my warning for parents today. Take your children and treat them like gold. My daughter at 15 years old is completely cynical about our medical system. She has had doctors telling her that she has something psychologically wrong with her for the last 3 years, and that has not been easy for her. She knows that physically she is sick, but traditional tests through doctors' offices and hospitals don't show you non-alcoholic fatty liver disease easily. There is a blood test that you could do and you should do annually for you and your family, and that's to check for the ALT and the AST levels in your blood. Those are the indicators of how much of the fat is getting sent out into the liver or out into your bloodstream. And they should be low. They shouldn't ever be high numbers there. So that's one way that you can find out if your child has this disease. The way that my daughter was diagnosed was actually through a stomach ultrasound. And they found that her liver was enlarged and had mild fatty liver. So that was 2008. Now we're in 2011. She has dealt with 10 months of extreme vertigo, spending 10 months in a wheelchair, which they were unable to diagnose or find a reason for. She started her period 2 years ago, and she has bled constantly every day since that time, and is on birth control to control that bleed, but it is always there and always impacting her. She has no ability to fight off colds or flus in the school system. So she goes to school not as often as a normal child should. She gets a cold, she gets a flu from there. It takes her 3 weeks to get over a cold or a flu, where it would take you or I 2 or 3 days. She can't take over-the-counter medications. If you read the back of any over-the-counter medication, you will see a line on there that says, do not use this drug if you have liver disease, or see a doctor if you have liver disease. So it is it's a vicious circle. Your liver is very sensitive to anything that you put into your body, not just eating or drinking, but also what you breathe in, what you put on your skin, the hair products you use. All of those things are actually coming in through your liver for processing. So the risk that I really want parents to be aware of, and new mothers to watch for, is that that fructose in your food products is extremely common. It is a very cheap sweetener that is added to make products addictive, and also make sure that they're cheap. So food manufacturers, starting in the late 70s, started increasing the amount of fructose that you saw in your products, and since that time we have seen the increase in fatty liver disease. So what I'm asking you to do is to become an informed purchaser. read labels. I think that's the most important thing that we do now. We read and look for where fructose or added sugars of any kind, whether that is aspartame, or dextrose or sucralose, any of those added sugars are actually causing problems because your body doesn't know what to do with these fake sugars. Fruits are fine. Those are natural sugars. That your body knows what to do with that, knows how to process it, knows what to do with the sugars. But that's not true for any of the artificial sugars or ingredients that are in our foods. So please look for fructose. Look at the sodium count on your labels. Make sure that it's a low level or a reasonable level, not 1,000 milligrams for a single serving or 900 milligrams. It's really scary when you start looking at canned soup, for example, or pasta sauce, for example, and you read the level of the sodium count. It's really quite shocking if you think about that being one meal in your day. For fructose, some of the products that I found fructose in Canada, and I believe that you'd actually find it in more products in the States than you do in Canada, but in Canada we find it in all bran cereal. Out of all things, that was one of the things that shocked me the most. This is all bran. It is little pieces of bran that you put on top of other cereals to increase your fiber count, which should be a good thing and a healthy thing for your body. But if you have a look at the ingredient list for fructose or for all bran, you will actually find fructose as the very first ingredient. So for parents and for moms-to-be, I do want you to keep your food intake and your child's food intake at an 80-20 ration. So 80% of the time it's whole foods. Stick to the outer aisles of your grocery store, the fruits, the vegetables, the organic milks, the organic meats. That's what you want to make most of your family's meals from. On the inside things, it should be 20% of your meal. There are sometimes we use packaged chicken broth because it helps with the number of cooking items when you're trying to make meals for your family. But I buy organic, low sodium chicken broth, so it is very difficult to know which products are safe. But I will be bringing some information to you via my video channel in the next month or so of different products that you should be aware of being out there that are actually healthy. There are organic bakeries, there are organic supermarkets, and you just have to still take the time and please read the labels. My daughter and I were in a grocery store not long ago that was a healthy store, and we picked up a little bottle of ginger. And ginger, it was just chopped ginger in a jar, so this should be a very healthy product. There shouldn't be any additives in it, but it actually had fructose in its ingredients list. So really be careful. Doesn't matter where you are or what you're shopping for. Take the time to read the labels and make sure that everything that you read on that label is a natural thing. You should know what it is. You shouldn't have to go to Google to search the ingredient list and say, what is this? So keep it healthy. Protect your babies, protect your children, and please don't allow your child to be impacted by this terrible disease. Non-alcoholic fatty liver disease, 1 in 3 of us have it now. 1 in 4, 1 in 3 of us will have it by 2015, and that does not ignore your children. And you do not want your children to deal with the pain of being a teenager or a young child who is unable to go to school, who is unable to participate in social activities, unable to maintain friends because friends want you there. It's very difficult, and I wouldn't wish this on anybody. And I do hope that you'll take the time to prevent your own child from ever encountering this disease. Thanks for your time tonight.